Today I am talking about questions and answers, specifically within the patient care room. Now, I have been trained as a hospital corpsman in the Navy, and I have been trained as a civilian nurse. And I will tell you that there is nothing like having a really good, thorough assessment. It's the bee's knees because it helps you understand what's going on with your patient. It helps you better communicate with the provider, and it helps the provider better communicate and help the patient. So it is literally just like the best foundation building block with a patient. So there are things we need to know about building a high quality assessment. We have to be systematic and we have to be thorough. Now, there are different ways to be systematic depending on which kind of department you work in. My systematic, thorough assessment on a stroke patient is going to be different than my systematic, thorough assessment of somebody coming in with an ankle injury. So that being said, let me start off with introducing you to Old Carts. I am sure there are plenty of you that know what the heck this is, especially if you spent any time in the Navy. So Old Carts is tried and true. Even my husband, who was a corpsman 7 years ago, still tried and true to him because he knows what it is because he built it into his core as a corpsman. So that being said, let's start. Old Carts, now I've changed a little bit, I will be honest. But anyways, so we have onset, location, duration, characteristics, alleviating and aggravating, remedies, time, and severity. All of these questions help us start to form a really good, high quality assessment. Whether that patient is coming in for an injury or whether they are coming in for just general fatigue. We can start by figuring out, when did it start? How do you feel? Where do you feel the most discomfort? Is there discomfort? How long has this been going on? Does it happen at a specific time of day? Does it happen at a specific time of your menstrual cycle? What are the characteristics? Tell me about how you're feeling. Tell me about how it feels. Tell me about when it feels the worst. And what is the rating of that worst pain or that worst feeling? When does it feel when do you feel the best? When does the pain feel its best? Is there anything you do that helps it feel better? Whether that is movement, food, medications that are over the counter, medications that are not over the counter, medications that are behind a wall. So we have these questions, right? And this is just the start. This isn't the whole kit and caboodle. And what is important to remember is that these questions start you off, and they also lead into really good follow-up questions. And as a medical professional, as a healthcare provider, whether you are a corpsman, a medic, a nurse, a patient care tech, a doctor, whoever you are, if you are communicating with the patient, your communication needs to be clear and consistent, systematic and thorough, and respectful. And as a patient, you have to be able to answer these questions. It is also acceptable for you to say, I'm not quite sure, I don't know. But I always encourage my patients, if you notice a change in your body, because I truly believe that a patient walking in is the best historian of their body, but the caveat is you have to actually pay attention to what your body is telling you. You can't just be like, yes, I know my body the best. And then I ask you, okay, so tell me XYZ of how you're feeling. Oh, I don't know, I haven't paid attention to that. Okay, well, that shows that we need to improve a little bit on paying attention to our body so we can actually be the best person to communicate for us. And there's nothing wrong with not knowing, but we have to be clear that we don't know. We cannot make things up, and we should not make things up as a patient. Now, as a provider, when a patient is asking you questions, it is important that you take time to sit and to think, whether that is just for 30 seconds, heck, a minute, I don't know, but it's better for you to sit and think and actually listen to what they're saying instead of just hearing them, so that you can use that Rolodex of information that you have learned either by book, by experience, or by mentorship and communication with other providers, so that you can inform them in the best possible way of what's going on. And it is perfectly acceptable also for providers to say, I don't know. Let's get some more information before I give you a set answer. Let me talk to my colleagues and see what they say, and I will get back to you. But the important thing is the follow through with all of those ambiguous answers. Now, I've kind of just dumped all of this information on you guys because I think it is so important that as a patient, we have the answers, or we have as close to the answers as possible. It's also important that we ask questions to our provider. And if you have questions, write them down before your appointment. If you have questions in your appointment, either ask them at that moment or write them down and wait until the end of the assessment is done to ask those questions. But asking questions to understand is literally one of the best things you can do, especially when medicine is confusing. And as a provider, again, asking good quality questions is only going to help you out in the future. So when we take time to ask the right questions, start in the right places, that can only lead to a better outcome. So remember, ask systematic and thorough questions to your patients. Don't be afraid to say, I don't know, let me get back to you, but be sure you always get back to them. And be respectful on both sides of the table, because it's tough being a provider caring for hundreds of patients. And it's tough being a patient in a situation where you feel absolutely helpless. And if the tables were turned, I'm sure people would still be confused on both sides, or nervous, or scared, or vulnerable. So we have to remember to work together as a team. And that includes the patient, the family, and then all the healthcare providers that come in contact with that patient.